Hi, my name is Dr. Jamie Fleming. I am a pediatric anesthesiologist and interventional pain specialist at Phoenix Children's Hospital. I'm currently the section chief for the pain section, and I'm double board certified in both pain and anesthesia. The procedure suite does have a lot of big advantages, and we're lucky to have one. It's hard to get space for these things sometimes in busy hospitals, and it's been really amazing that we have this resource. But it lets us essentially match the setting to the child and to the procedure. And this has a lot of advantages because each child is so different. Some patients really require anesthesia, and some really do not. And that can depend on age and anxiety around the procedure and a bunch of different things, but it allows us to customize to that. When there's patients that really don't require anesthesia and are getting a relatively low risk procedure, we are able to move them into the procedure suite. And this sometimes lowers anxiety for those patients because for some patients, the thought of having a procedure in the operating room makes them associate it more like a surgery, and it can ramp up anxiety. So this allows for a calmer, less intimidating type of environment for some of these patients. And it really does improve access because we can avoid some of the scheduling constraints that we have in the OR. And this also, when we can take some of these patients that are able to have a procedure in our suite, this opens up more spots for the children that need anesthesia in the OR. So it lets us to really work on going around scheduling constraints and matching things better for the patient overall. And, this is a big advantage too when you're looking at treating chronic pain because time does matter. You want to treat patients quickly and start to improve their function quickly for best outcomes. And if we're able to do their procedures on a more timely fashion, we are going to accomplish that goal more easily. And, in the case of injections, sometimes these injections can get patients over the hump where they go from not moving to be able to participate in physical therapy and other activities. And the sooner we can get that going, the better. I love that question because it is such an important one, but there's several things that pediatricians can do to really help these children when they come in with chronic pain. The single most important thing is to validate their pain and tell them that you believe them and that their pain is real. You would be surprised at how often patients hear that it's all in their head or that, their pain isn't real because they didn't see something on diagnostic studies, but can't be further from the truth. And then the second thing is to recognize when it's really impacting their life and their function. And those are definitely the two main things. The five things really to focus on are validate their pain, explain in simple terms the way that their nervous system functions and how it generates pain signals and how it's influenced by different things going on in their life. Encourage gradual return to function and also screen for things like poor sleep, mood problems, also stressors going on at the home or at school, and then refer early, especially when function is declining. That's really the key. What also you can do that's very helpful is coaching the patient and their family. The family will be a big key in what this patient's doing at home and how their pain is overall managed in their regular environment, and the family coaching is really critical. We can go back to an example in something that probably a lot of pediatricians see and that I've certainly seen many times, but let's say you have a child coming in with abdominal pain and headaches, and they've undergone a workup, which overall looks normal, but yet they're not going to school. They're afraid to participate in physical activity. If we say something like, your imaging and workup are normal, you are fine, that's very invalidating, and the patient and the family will feel very dismissed. But if you say something like, I believe your pain is real, and now we need to help your nervous system recover and help your body recover, we can really change the trajectory that patient and family experience. And again, the goal isn't zero pain, the goal is to restore function. So it's extremely important to deliver that message as well. And really, if the child gets back to school and movement and doing the things they love to do, that's really a clinical success. But on a bigger scale, it's also prevention of disability and preserving their developmental trajectory.